Greetings and welcome to today's webinar. My name is Alaina Kennedy and I'm the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans, commonly referred to as IAMHP. Today, we are partnered with Molina Healthcare of Illinois to discuss strategies on building bridges between community-based organizations. But before we dive into the presentation, as well as introduce our panelists, I'm going to take a few moments to walk through the platform a little bit more. As you can see, IAMHP utilizes the GoToWebinar platform for all of our webinars. Thus, a GoToWebinar control panel should have popped up on the right-hand side of your computer. This is how you're going to interact with today's presentation. Hopefully at this point, all of you should be able to hear me, either through your computer audio or through your phone audio. Should you lose audio connection at any point, please note you can move between computer and phone audio with ease at any point during the presentation. Please note you may have to give computer access to the platform if you are going to use your computer for audio. We will keep everyone in a muted state though throughout the presentation and during our Q&A. To interact with today's presentation, I direct you to our questions tab. You can direct technical questions about the platform, about IAMHP, or about today's presentation via the questions tab. I'll be answering a few of those as we move along, but collecting a few of those for the Q&A section at the end of today's presentation. Additionally, we have our chat function, which is a great way to build community with all of our attendees today, as well as myself. I'll be coming up as IAMHP admin or IAMHP organizer on your end. Please note that we have many providers as well as MCOs attending today's presentation, and we know that due to some firewall protections at your organization, you might not actually be able to access the chat function. We apologize for that inconvenience in advance and appreciate your understanding. Additionally, I should note that depending on the version of GoToWebinar you have, you might not also be able to access the chat function. Moving forward, I always encourage our attendees to update and have the latest version of GoToWebinar so they can interact with other attendees and utilize this function. With that out of the way, let's move into why all of you are here today. As noted at the top of the hour, my name is Alaina Kennedy, and I'm the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans. And we work intimately to improve the lives of individuals and our communities here in the state of Illinois. But we know working within the healthcare system is a never-ending job and can never be done in silos. And that's why we work with our community partners, advocates, administration, MCOs, providers, to really invest in and provide high-quality healthcare. And which is why we actually are convening today for today's presentation and have partnered with Molina here for this important conversation. So as noted, during today's webinar, we're going to examine the impact of the COVID-19 pandemic and really walk through the heightened social unrest on vulnerable communities, review different initiatives and strategic plans that can help reach these populations, and discuss ways to build relationships in communities to develop partnerships and opportunities that ultimately help. As noted, we can't do this in a silo, and so it's really going to take all of us collectively to improve and support these communities. And I think one of the important things that I've talked a lot about with the Molina team and others as we've moved throughout this year is that this time has really created a lot of wonderful opportunities to think creatively and build rapport within and across diverse populations, and thus execute as solutions in a culturally sensitive and appropriate way. And so I know that we've got some fantastic people here to really dive in and talk about that in further and greater detail. So I'm going to take a moment now to introduce our wonderful panelists today. We've got Laurinda, Dodgen, Community Engagement Specialist and Associate Vice President at Molina. We've got Chris Javier, Deacon at Chinese Christian Union Church, and then Officer Patrice Turner of City of Rockford here today, and they all come with their wonderful perspectives. And so with that, I'm going to hand it over to Laurinda to get our presentation started.
Thank you so much, IAMHP, for the opportunity for us to be here. Again, my name is Laurinda Dodgen. I'm the Associate Vice President for Community Engagement for Molina Healthcare of Illinois, and I am blessed to have the opportunity to work with such amazingly talented people who create interventions on a daily basis to address community needs. So thank you again for having us. So in our first session, we discussed how COVID and social unrest provided an opportunity for Molina to serve community differently. While focusing on addressing social determinants of health, Molina's areas of focus included looking at ways to improve the healthcare system through provider partnerships, creating opportunities for students to have accessible education through our laptop giveaway program, bolstering economic stability, and addressing food insecurity by creating numerous drive-through programs, such as our drive-through job fair and our drive-through food events across the state of Illinois. Next slide, please. But within this webinar, I will introduce two community partners from different communities. We will discuss the importance of creating connections that are rooted in shared goals, the importance of creating culturally appropriate solutions when creating interventions that address social determinants of health needs within a community. And finally, we'll discuss lessons learned in evaluating our programs to create better long-term outcomes to address community needs. Next slide, please. First, we talk a lot about cultural competence, so let's define it a bit. Cultural competency enables healthcare professionals to meet the cultural, social, and linguistic needs of their patients, and working within a culturally competent framework that shows respect for beliefs, cultures, and values creates an atmosphere of trust and honesty at the individual and the community level. Next slide. So we'll talk about ways to approach building relationships across community-based organizations. And I'd like to introduce you to two community partners that have provided me with an opportunity to serve the community better. Now, Molina works across the state with a number of amazing community-based organizations, and we've created a lot of initiatives, but I chose two specific partnerships for a variety of reasons. First, I chose to showcase a partnership we have in Chinatown because Molina was very new to Chinatown. We didn't have any partnerships. We didn't have any relationship there. So as we were working through the pandemic and through social unrest, not only were we having to build our brand, build who we are in community, we had to listen, we had to engage, but we were literally building this initiative and building the relationship at the same time, whereby as in Winnebago County, I was born and raised there, so I have relationships there. And so we knew one another and we knew what each organization was capable of creating. It was just creating that initiative that would be able to address and focus on community needs. So within both of those organizations, we had to listen intently and engage one another while we were creating strategic initiatives, and then evaluating those outcomes to see, did we do what we said we were going to do? Is there something that we could be doing better? Are there needs that we didn't address, and how do we move forward? So without further ado, I'd like to introduce my first speaker and partner, Officer Patrice Turner, who is a police officer for the city of Rockford. Next slide.
Hello, I'm Officer Turner of the Rockford Police Department in Rockford, Illinois. I've been employed as an officer for about 19 years, the last 4 of which I've been a Rock House officer. Rock House is a community policing initiative that's aimed to cultivate and strengthen relationships with the community. The word ROC in the Rock House title is an acronym, and it stands for Resident Officer Community Keeper. As a Rock House officer, I actually live in a house that's provided by my police department in an area of a town that was once deemed as struggling. I actually police from my house, so I don't have to go into the department or do roll calls like a typical officer does. I do all of my work based out of my home. Another large component of my job is community programming. My department actually gives me the freedom to exercise creativity and creating different programs that will help benefit our community. In 2019, the negative effects of the pandemic and social unrest were hitting my programming pretty hard. Things had slowed nearly to a halt for me as far as programming is concerned. During that time, I was able to focus more on what the community needs were based on just the pandemic. And doing that assessment, I realized that due to quarantining, seniors weren't able to get food and other essentials as easily as they once could. A lot of them were shut-ins. They just couldn't get out and get around as much as easily as they wanted. So I reached out to Dodgen and Rojas and explained she could that pantry along with food. That program was very successful.
Oh, officer, I think we lost your connection. I do apologize.
I think
Officer
so
Patrice, are you
too.
there?
So I'll talk a little bit about the program. So as Officer Turner was saying, the community had eroded some trust. And so Molina partnered with Rock House to create a senior food insecurity program. So as you see, there are pictures and photos that are being shown of Officer Turner providing meals to various seniors. And so it started out with Officer Turner being the one that would go to resident homes and provide meals, and then it grew from there. So there were about, I believe, 10 officers that would go around to the surrounding seniors and provide food and services for seniors. And so that was our initial program with
You guys,
I can hear you, yes.
sorry about that. Apologies. I had to run to a different spot to get some more connection here, better connectivity. Apologies. Um, Basically, I was just saying, like you just said about the food program, how we had gotten together, and it started out with just me delivering food items to different seniors who couldn't get out, who were shut in, who couldn't get out because of the pandemic. And it ended up being anywhere between 6 and 10 officers a day delivering grocery bags full of food to seniors who couldn't get out and get it on their own. So that was a very good program. It was very cool. In doing that program, I actually got a chance to speak with Laurinda, Dodgen, and Jennifer Rojas further and explain to them a different program that I had going at the time. It was a laundry program. Next slide, please. That laundry program was called Fresh for Summer, and I'm sorry, Fresh for Learning laundry program at that time. Fresh for Learning was a program that was initially a truancy initiative. It was put in place to keep school kids in school. It was to prevent them from skipping school simply because they didn't have fresh, clean uniforms to wear to school. So in the Fresh for Learning laundry program, each student got to wash and dry 2 loads of clothes for free, along with detergents and things like that. Everything was free of charge. So I explained that to Laurinda Dodgen and Jennifer Rojas of Molina Healthcare, and they loved it. They wanted to know, how can we help? So along with Molina Healthcare of Illinois, I found another partner here in town called 5 Alarm Coin Laundry. And we basically blew the program up. So when I say blew it up, Molina stepped in and just made me able to help even more families than I could before. So at this point in time, every Wednesday night's the day we do our laundry program, we're helping anywhere between 20 and 30 families keep their clothes clean. Now, even though I say 20 and 30 families, keep in mind that each family doesn't only have just one kid in school. They might have 1, 2, or even 5. I know one young lady, she has 8 kids. So that many children are being helped every week, which is an awesome thing. It's a very big deal. That program has been wildly successful, so much so that the program is expanding on the southeast side of town. They're actually opening another laundromat and allowing me to put the same program in that laundromat so that other kids on that side of town can partake as well. So that's really cool too. These programs were instrumental in building healthy community relationships, and it was all made possible by working with Molina Healthcare. So I really just want to say thank you guys so much. We really appreciate it. I appreciate it. The community here appreciates it. I've also been doing talks with Molina about expanding the partnership. I have other programs that are running right now, one of which is a soccer program. It started out with just a soccer program, just a group of boys, about 20 boys. We got together 3 days a week and played soccer. But in doing that, it kind of grew to playing soccer and talking about different life skills and life lessons, like such as how to be respectful, hygiene, healthy living, things like that. And I've been doing talks with Molina about it, and they'd like to partner on that as well. So once again, I thank you, Molina Healthcare of Illinois.
Thank you. It's been an amazing partnership. And again, as I was stating that the relationship with Officer Turner, we already had a long-term relationship. So really, we didn't have to work on building a relationship and then doing programs. We literally just, looked at the community need, what is it that we need to do, and then created programming around that. So thank you so much. Next, I'd like to introduce Chris Javier. Next slide, please.
Hello, everyone. My name is Chris Javier. I am a deacon from Chinese Christian Union Church in Chicago's Chinatown, and I'm really honored and blessed to be here with you, sharing about the work that we've been able to do for the past year and a half with our church and Molina. Actually, by trade, I'm a science teacher, and when it comes to community organization and doing work in and for the community, I'm completely new to it. And so my start in supporting Chinatown actually came with the pandemic. And so when the pandemic hit, Chinatown was hit probably before anybody else. And we had to mobilize really quickly to start to provide for some of the needs. For example, I think Chinatown, because of a lot of the fears and outright racism, Chinatown's businesses were hit hard. And they were hit harder and faster and earlier than other places. And for our neighborhood, a lot of the income for the residents, it's dependent on the restaurants. It's dependent on the tourism. When that shut down, that put a lot of people's health in jeopardy. And so we had to organize something quickly, and that's what we started to do. So as a leader of my church, I just said, hey, let's pool up. Let's just try to get some money, and we got to do something. Let's try to get money to provide as many meals as we can. And I was thinking, it doesn't matter if we get a couple hundred or a couple thousand, we're going to just do what we can. Within a week, we raised $40,000, and we were really excited about that within the church because we wanted to start to provide for our community. However, what we ran into was, if we use that money to go buy food, we were going to run out of money quick. So we started partnering with other local programs from other neighborhoods to see if we could get in on some of their food distribution efforts. And what we learned was that even though it helped to get some of their boxes and deliver them from Pilsen to Chinatown, when Laurinda speaks about cultural competency, that's something that we overlooked in our first few distributions. And so we were getting we were getting Hispanic food that was given to us, and it was a gift. It was a blessing for sure. But when we were giving that, especially to our elderly, they couldn't use it. So different cultured foods they were unable to use. Some just had dietary restrictions, or they just couldn't, they couldn't eat that. And so we learned a couple of distributions in that, man, if we were going to serve our people, we were going to have to really dig deep into our pockets to buy food that they eat, that's culturally competent for them. What that meant, though, was that across the costs, we were only going to be able to hold 5 food distributions. So we just said, if that's all we can hold, that's all we can hold. So we started our distributions, and around the 3rd or 4th one, I'm not sure how, but Laurinda heard about what we were doing, and she contacted us and said, "Hey, we heard about the work that you're doing in Chinatown, and we would love to talk about how we can support the work you're doing." And I can't tell you that was such an amazing blessing, a timely blessing for us, because we thought that was going to be it. And if you fast forward to today, to date, we've done over 29 food distributions now. And instead of giving out what we thought was going to be maybe 1,000, 1,200 food packages to different families and individuals across Chinatown, that's now over 9,000 because of Molina's intervention, because of Laurinda and her team stepping in and saying, we're going to support the work you're doing in your community. And so because of their support, not only were we able to extend that support to those who are unemployed and struggling for food in our neighborhood, but we also expanded the kind of services that we could provide. And so around the time of a lot of the social unrest of March 2020, we started going around not only in our neighborhood, but also to surrounding neighborhoods to do community cleanup. And that has continued to expand. You could hit the next slide, please. So one thing that we've started to do was, even as the pandemic was setting in, what we were seeing was a rise in anti-Asian hatred, anti-Asian racism, and anti-Asian violence. And we were seeing that mainly across the nation, right? We were seeing it a lot in the West Coast and the East Coast. And as we saw that really rising and spiking, we decided we're not going to wait for that to come to Chicago's Chinatown. We need to be proactive. And so we started doing research in our neighborhood and amongst other communities to just look at what are the historical roots of some of the violence. What does the violence look like? What can we trace that back to? And then what can be done? And what we started to learn was that as we look to different community orgs, different partnerships, we teamed with police to hear from them. And we were communicating with Molina as well. What we learned was that if we were really going to promote peace in and for Chinatown, we couldn't do that only for Chinatown. A true peace would have to mean peace within Chinatown, but also between Chinatown and surrounding neighborhoods, because there has been a lot of historical, let's just say, historical scars between and breaks in relationship between these communities. And so we started engaging with different communities on across the south side of Chicago, mainly Bronzeville, Bridgeport, and Chinatown. And what we wanted to do was partner to get some efforts to promote peace in our own neighborhoods, and then work together to share that peace and share our efforts and collaborate across different neighborhoods. What that's looked like is a project that we call the Chinatown Peace Project, and we're going to be expanding that to the Bridgeport Peace Project and Bronzeville Peace Project. One of the things that we've been doing has been going out into the neighborhood and just going door to door and talking to neighbors about safety concerns in the neighborhood. And the power of that is that we're not only going out in Chinatown with people from Chinese Christian Union Church, but we're going together with people from Bronzeville and Bridgeport. That's Black, white, Hispanic, and Asians going out into Chinatown. And what that does is, what we're starting to see is it's starting to break down barriers for people in our neighborhood who may have only seen people of other races a certain way, to see them come together as one group that's advocating for their safety has been a game changer. And we are going to continue doing that together in Bridgeport and in Bronzeville as a display and a really strong move towards unity between our communities. Another thing that we're doing together is we're working with local school support initiatives. And so we started in Chinatown with 3 elementary schools, and we wanted to let teachers know that we wanted to support them. And the reason is because as we looked at the causes of violence in different communities, one thing that we learned from our research, and it's just truly heartbreaking, is that when private prisons are looking for a place to build a next prison, one of the main stats that they look at is an area's elementary school reading levels. Now you might be wondering what does a private prison have to do with elementary school reading levels? For them, what they see in their data is there's a strong correlation between 3rd and 5th grade reading levels. If they're low enough, within a low enough threshold, that's a good predictor that those children will then go on. It correlates to a high school dropout rate. That high school dropout rate also correlates to high gang or criminal activity. And because of that, if that's correlation is true, then that area will need a place within 10 years to house those current 3rd and 5th graders in a prison. And it's absolutely heartbreaking to hear that. And I know whenever I've shared that at different community groups as we've done solution building, that the instant reaction is just everybody is just disgusted by private prisons. And I wouldn't speak against that for sure, but one truth remains is that whether they built the prison there or not, that data still holds strong correlation. And so what we want to do is, instead of supporting a building of a place to house our current 3rd and 5th graders, what we want to do is we want to interrupt that cycle by just flooding our elementary schools with support. And so in talking to these different community groups across these neighborhoods, we decided it would not be good. It would absolutely be terrible if all of us pulled up as a team and just went only to these schools that are struggling, because what that comes off as is like a savior mentality. Like, hey, we're here to save you because you're struggling and you're the ones who need help. So instead, what they were saying was we should start in our own neighborhoods and then branch out from there, so that we're just making concentric circles out from our neighborhoods, and we're hitting elementary schools along the way and just supporting schools as we move out. And so that's what we started on. And so Molina helped us in this past June to go to 3 elementary schools in Chinatown. And we just went to their teachers and said, hey, we appreciate the work that you're doing. We also want to celebrate the children for getting through an incredibly historically difficult school year. And we threw end of year celebrations, and also we made sure to get gifts for every teacher and staff within those buildings. And that was just, if I could just I wish I could communicate to you the look on the teachers' faces, on the students' faces, to know that there were people that were supporting them, people that were cheering them on, that their classroom and what the work that they were doing was important and appreciated. Man, that was amazing to do. And what we want to do is we want to continue to do that in other communities. Doing that has led to increased rapport for within that community, for Molina, and even for us, because it's brought us a lot of trust, and it's given for my organization, for Chinese Christian Union Church, a huge amount of momentum. Right? We've seen and we've tasted, and we're ready for more. And we know that if we put our heads together, put our resources together, and start to move forward, that God can do amazing things through the work that we're trying to do. And God bringing Molina along has been a true blessing. If you could click to the next slide. So this slide we titled Wins and Lessons Learned. As Laurinda and I were talking about this, there have definitely been successes, and we celebrate every single one of those, such as building bridges across communities, identifying different key organizations that we can work with, finding those common goals, and then viewing every community's unique needs. However, along the way, there have also been what we wouldn't call losses, but definitely lessons learned. For example, even as we're building the bridges, we know that that's delicate work. One example I can give you is as the violence increased against Asian Americans across the nation, we wanted to work with 3 communities, again, Chinatown, Bridgeport, and Bronzeville, to just hold a unity prayer march. So we worked with 3 churches, and we were ready to move forward. We were getting this thing ready in like a couple weeks, and we planned a prayer path to go from a church in Bronzeville, go through Bridgeport, and then come to Chinatown. However, as we were moving forward, what we ran into was that there were members of the church in Bronzeville, which is a predominantly Black church, and they, as we talked about and promoted the prayer march, they felt very uncomfortable, especially the elderly in their church. They felt very, very uncomfortable with marching through Bridgeport, which is now a very diverse neighborhood, but historically a very white Italian neighborhood. And so what we decided we needed to do was we needed to pump the brakes. And instead of, even though we had great goals, right, marching and having a prayer march towards unity, we're dealing with human beings who have been through things, and we need to be sensitive to that. And so we decided we were going to pump the brakes. We need to reevaluate, and we need to be very sensitive to the emotional and even physical baggage and trauma that our people have gone through. It's very delicate work. Secondly, when we're identifying key partnerships and organizations, the working relationship and achieving the common goals, even though if we have common goals, achieving the common goals can be difficult if we're not all on the same page. It was amazing connecting with Laurinda, because I think both of us are individuals who are about going after it right away. So once we connected, we had the same goals. We were just like nonstop communication. We could get an event going in a week, very little turnaround time. And what we're seeing is that even though many organizations across different communities also have those same desires, that doesn't mean they work the way we do. And we need to take time to build up those relationships, establish understandings of communication, and move forward in a way that is beneficial, and that is, I think, even just logistically feasible for all parties involved. And then finally, each of community has unique needs and concerns that need to be addressed. If they're not addressed, the good that we want to do can end up doing more damage. And so we've done a lot of good. We've got a lot of great work ahead of us. But the way that we do that work, we can't just do the right thing. We got to do the right thing rightly. And so Laurinda and I are putting our heads together and making sure we're very careful about that moving forward. I think next slide. Yeah. So some key questions to consider as we move forward. First, who are the key organizations that are doing the work in the communities we serve? We can't go into, even as we looked in Chinatown and we wanted to start serving other neighborhoods, we can't bring our Chinatown developed solutions and try to bring them to bear on our surrounding neighborhoods. It's going to backfire. It's going to cause more problems. So we need to make sure we're looking at who are the key players that are doing similar work. How do we establish those connections and then build relationship so that we can move forward? Secondly, what kind of initiatives are being implemented and what ways can we add to it, right? So even though we're developing new ways to serve our community and we've got ideas on how we can also serve other communities, and a very important step has been looking at the work that has already been done. And the great thing about that has been it's also informed the work that we're doing together in Chinatown. And then finally, how can you ensure that your presence aligns with community needs and values in a holistic way? Like I had said from the previous slide, if we look at a solution that seems good for one isolated issue, we might be missing a whole slew of factors that we could be culturally blind to. So really depending on our partners in that community to give us the whole picture on how an initiative that we might develop can impact what impacts that might have on the rest of the community, that's vital. And so these are things that we need to make sure that we're always bringing to the forefront and that we're always sensitive about. Thank you.
Thank you both so much for just providing a background. And when I stated that I was introducing you to two community partners that helped me serve community better, they definitely demonstrated that. And so when Chris said it's important to, oh gosh, how did you say? Serve rightly? I think I messed it up, but it was amazing. So yes, you want to make sure that not only are you trying to do the right thing, but that when you're creating your intervention, you're working in community, that it's doing the right thing, that you're doing what you're set out to do and you're not causing harm. So thank you both so much for joining this panel. Next slide. And if you're interested in partnering with Molina or you have questions for Chris or Officer Turner, please feel free to reach out to me directly at laurinda.dodgen@molinahealthcare.com. And now I think we're going to open up for some questions.
Wonderful. Before we dive into questions, I just want to pause and say thank you from the bottom of my heart to all of our panelists today for taking an hour out of their day to walk through this very important topic. I think there is a lot that has happened to us, and as we continue to reconcile with the trauma that we've all collectively experienced individually, as a community, and as a nation, I think it's important for us to reflect on the wins and the losses and the lessons learned so that we continue to grow in our communities in a way that is sustainable and, to the best of our ability, sustainable and supportive. So thank you. That being said, there's still so much to unpack. So to all of our attendees today who are attending live, please note that you can submit questions via the questions tab or the chat tab. I'll continue monitoring this as we move along through our question and answer section today. And we'll be answering, hopefully getting answers from our panelists. With that being said, I would like to kick us off though for the Q&A and ask to all of our panelists, I should say, what was one thing you learned out of this experience that you did not expect to learn or was contrary to what you expected? And that could be both for the positive or for the negative. And so, Laurinda, let's start with you.
One thing that I learned,
which is hard, I understand, because I imagine you learned a lot of things. I mean, that we all have. But I suppose to reframe it in a different way, what's one thing maybe that you learned that also could be beneficial for our attendees today and who might be in various walks of life or experiences, but all are here for collectively the same reason?
Okay, so I've worked in community for all of my adult life, and I worked in very diverse communities. And so I've always been proud to say that I'm generally like attuned, right, to various communities, and I listen and I try to be respectful. But I think the one thing that I learned the most was just working in Chinatown with Chris. And initially, when he stated he didn't know how we met, but there was a community forum, and I can't recall who created the forum, but it was a lot of community organizations in Chinatown that got together to talk about community issues and how they would work together. And so I was invited by a very close friend to join this call and introduce who we were as an organization. And so I provided, some of the things we were doing across the state. We were doing a lot of drive-through food events and things like that. And it seemed, no one really wanted to work with us after that. So I didn't hear anything for maybe like a month. And so I reached back out. And so I just kept reaching back out. And I didn't understand if while I was hearing all of these needs and I'm providing a potential solution, why no one wanted to work with us, right? It was like, I didn't understand it. But then I was introduced through grace to the church. And I think what came across in our first initial meeting is just the organization being unsure of who we were and what we wanted. So because we, are seen as such a big organization, they really wanted to know, like, why are you wanting to help us and what do you want out of it? And to fathom that we're just trying to do good in community was, I think, a little bit difficult in the beginning. But we definitely try to hold up, our brand and who we say we are in community. And not only were we putting financial resources to an issue, we were also coming and supporting and being there on a monthly basis. We showed up. And so I think for me, the lesson learned was the importance of just creating relationship. Like, we know that that's an important thing, and just having what you feel may be a solution is not always enough because there's not a trust factor there. So that was like a really big aha moment for me. Surprisingly to say that it was, but it definitely was. And so I'm glad that we were able to overcome just on both sides insecurities of not knowing one another organizationally and creating such a really great relationship.
Laurinda, I think you made some fantastic points, and I think that your comment about trust is so important. We might have a really fantastic idea and think that this is what could do some amazing things, but we need to connect with community and give voice to the individuals that we're also trying to support. And I think that that element of trust and also bringing voice is so vital and so important. To our other panelists as well, did you have any additional color or lessons learned from your perspective?
I learned that there are many other people that are just as passionate about helping the community as I am. I think a lot of times I didn't think to ask others for help. I just kind of took care of the issue or tried to take care of the issue by myself without realizing that all I had to do was open my mouth, talk to some people, and they would feel the same and help out too. For instance, that laundry program that I was talking about, it initially just started with me passing out quarters to kids at school so that they could wash their clothes that night so that they could make it to school the next day. I never imagined that, just by opening it up and asking for help or mentioning the program or what I was doing to someone else, that they would be just as eager to help me with it. So I think that was a big lesson that I learned. Another lesson I learned was that like the things that I consider to be minor things like that, helping kids to get clean clothes. For me, that was just helping kids in my community, kids that I care about naturally because, I'm born and raised here. I'm from here. I consider all kids to be my kids. But to me, it was not a big deal. But the more people I told about it, they thought it was a big thing, like very awesome. It's even been highlighted in places such as like Wall Street Journal and Al Jazeera News. And I just never thought in a million years that the work I was doing was like a big deal. To me, it's just helping others. So it's awesome to see that other people, not only do they find it intriguing or like a big deal, but they want to join in and help as well. It's like catchy, and I love that.
I know you can't see me, but Officer Patrice, when you talked about handing out quarters to children, I clutched my heart. Oh, that is such an amazing story. And I think also it just also is humbling. Thank you so much for sharing. But I think that what you also talked about is that it is nice to hear that there's others within our community who also are thinking, in the same way or want to help support that. And so also by working with other community members, how we build up that 360 lens. You might be coming at it from this perspective and having these set of tools, but then when you partner with someone such as Laurinda or a health plan such as Molina, how they give another set of tools or another perspective, and then collectively can have just such a larger impact on the community. So thank you for that. Chris?
Yeah, I was just going to say, I think one of the lessons learned was when it comes to being a blessing in the community, I know a lot of people want to have the plan completely laid out from start to finish. And maybe this is I don't know if this works for everybody, but what I've learned from this is when it comes to helping people out, you have to start. You have to start. And so a lot of the early conversations before we started to try to raise money to try to address the food needs, I would say the first 3 or 4 people that I brought it up to within my organization, within my church, they wanted to pump the brakes on that. They were just saying like, hey, I don't know, because how are we going to do that? We've never done that before. It's COVID time, so we got to be careful, this, and that. And so that could have been nothing, right? And if I look back almost, a year and a half later, we look at all the great things that came about because we just said, we don't know what the second step even will be, but the first step is let's just start to raise money and see. Did I lose you guys?
Yep, you lost us for a second.
Oh man, okay, sorry. Well, I was just saying that, long story short, we needed to take the first step, and we weren't sure sometimes what the second or third step was going to be, but we needed to start moving, and taking that first step led us into like relationships and solutions that we did not know were going to be there unless we took that first initial step. So yeah, it definitely emboldened myself and my church to make big moves on behalf of others.
Well, and that's such an amazing part because I know there's many of us, and actually we did get some questions in that same vein of where do you even start? And many are talking about project plans, and there's a lot of discussion about that. But I think what you said, just starting, is so vital and so important. And sometimes I think that the community also communicates back to you then what your next step is and what your third step is then. Because once you start, it starts to kind of become a groundswell, and then the community can give positive or negative feedback loops to you so that you can continue building on that work. So I think that's a really important point for all of us to walk away with is to start. Now, Laurinda, to your earlier comment, though, you had mentioned you had gone to some events. It might not have panned out right away. But I also liked that comment about don't be discouraged. Even if it's not panning out right away, don't be discouraged and keep at it. But how do you figure out, and this I'll open it to all the panelists, Chris and Officer Patrice included, how did you figure out who to target or how to communicate with? I think we got a few questions from some people not even knowing who to start to talk to.
So I can take that one. I think as it relates to, because both communities for me were very different. Like Winnebago County, I'm born and raised in Rockford. So that was really easy. It's like, who's doing the thing that I want to do, and who do I need to be my validator or introduce me? So, for Officer Turner, I've known her for a very long time, so I didn't need that. But in Chinatown, I don't know anyone. I don't have any relationships. And so I leaned on a former volunteer who's very well known and who just has a lot of connections in Chinatown. And I reached out to her and I said, hey, this is what I would like to do. This is what we're trying to do. Can you assist me? And she connected me. So she was like my validator. She was the person that she already had trust that I did not have. And she introduced me. And that helped to open the door. So sometimes you have to go in blind with no validator, and that's just about you showing who you are and your intentions, and opening the door and just building a relationship. So although I had her to open the door for Chinatown, I had to bring myself, because she didn't go into the meetings with me. She just sent an email introduction. I had to do that for myself. And so I think that one thing I do bring is authenticity to my work. I don't do things that I don't believe in. And we truly want to be a fabric, and we truly want to help community. And so I think that that also showed true. I'll give an example of, I had an idea of having them partner with another nonprofit that provided food source, and they would have provided culturally appropriate food. But then the church came back and said, we really want to work with vendors in Chinatown. And I was like, of course you do. Yes, let's do that. Very easy, very simple. And we changed course, and that's what we did. But it's because, I understood what they were saying, and I understood the importance of keeping money local and community, and I understood what was going on with the restaurant business, and why wouldn't you want to work with organizations that and help them stay in business. So it was just really easy to pivot and listen when concerns were brought up, and then take action. So.
Yeah, I'd like to speak to that as well. Like I said, I'm new to this community organizing and this kind of work. And so for me, even though Chinatown has been home, I'm half Chinese, half Filipino, but culturally I'm American. I don't speak Cantonese or Mandarin or Taiwanese or anything like that. And so when it came to the idea of I want to help in Chinatown, I really came into it from the lens of, I'm here and I'm local, but I am culturally an outsider. So the first steps of that I had to take was, instead of saying, okay, here's my idea as a very Americanized Asian on how I can help Chinatown, and then just bring that to bear. My first steps were all research. Everything was research. So I started to call up people in Chinatown and people within my church. I was like, hey, who's doing this kind of work? Or who are the community organizers that are really active? I was looking through Facebook. I was making like connections through connections, and just setting up conversations. And those initial conversations, that research that we did, we built our plans off of that. And I probably should have mentioned this. I think Laurinda already touched on it, but it wasn't just a partnership between Laurinda and myself, between Molina and CCUC, Chinese Christian Union Church. The events, we collaborated with 7 different Chinatown community orgs because we saw that they were doing good, but nobody was addressing food needs, right? So not only did we, in going to these orgs and finding out what we did, we found out how they supported, and we didn't want to reduplicate those efforts. So what we said was, okay, well, nobody's doing food needs. What if we all pool together to take care of those? Right. And that's how we addressed the unaddressed needs, which made it very powerful in 2 ways, because 1, there was the collaboration from community groups that are active and for Chinatown. But then 2, it addressed needs that were completely unmet, critical needs, critical food needs. We used that exact same approach when it came to addressing safety in Chinatown. Instead of just saying, okay, we gotta do something now, that went into months of research. So that research started in it was like a gnawing on our hearts, from March. It wasn't until November of 2020 that we said, we really got to start meeting with groups and learning. So we learned from all the groups in Chinatown, and then we bridged out to surrounding neighborhoods to say, hey, what do you do? We want to provide safety. What's your context like, and what do you do? And we learned about how there were some things that could transfer over and help us, but there were some things that were culturally different in those neighborhoods. But then understanding those contexts, that also helped us to see the connections, which is why we said from different groups is like, hey, we're addressing this in different ways, but man, there's a big need for us to work together to address a common need, which is common understanding and increase rapport between our communities, increase peace between our communities. So when we come to the question of how do we start, I think it's asking a lot of the right questions, like in humility, and I think those answers really drive the path and the building of solutions.
Well, I have to say that I was just my neck's about to start hurting. I was nodding in agreement so much, Chris. I think that the humility is an important and key factor in this, and I think that it's also recognizing that we are all our own experts in our own ways based off the perspectives that we've had in life, but have the humility to step back also and listen. I think that that's something that I'm kind of also taking away from this experience is listening to those in the community, ensuring that others who are experts in this space also have a voice at the table, not being duplicative, seeing where there's an opportunity. You know, for example, you said there was an opportunity for the food as well. And so I think there's some really great lessons that I'm peeling back that I'm taking away. And I hope that all of our attendees too can take little bits and nuggets back to their community and their specific specialties as well, whether they're coming from the perspective of a Medicaid managed care health plan or from a provider, community advocate, or just someone who wants to learn more about this space. And I think also to Chris's point, start now. Start having those conversations. You can reach out to, for example, Laurinda here or all of the other health plans, the Medicaid managed care organizations are doing important and different work in the same way. Today, as we noted, we partnered with Molina. But this work is happening in different ways and different facets all across the state of Illinois. And so if you are also interested in partnering with other health plans, feel free to reach out to myself. If you're also interested in reaching out and talking to our other panelists today, we are certainly happy to get you in connection with them as well. With that, we are at 3 minutes, sadly. So with that, I just want to see if there is one quick thing that you would want everyone or an attendee to walk away or ruminate on after today's conversation. We'll go really quickly. We'll start with Officer Patrice. What's one thing that you would like an attendee to walk away with?
I would just like to say, don't be afraid to build those bridges. You know, reach out to different members and different places in the community that may be interested in supporting the same cause as you, because one is good, but two is better. You know, two hands are definitely better than one. So don't be afraid to reach out to help build those bridges.
Agreed. Chris?
Yeah, I would encourage everybody to, like Alaina was saying, start now. Because the faces that we've been able to see, we're talking about like 10 over 10,000 people who we've served. Those were people who were blessed. Their lives were affected. Their lives were changed because we made some moves. And so you guys have access. You guys have resources. You guys are in different places with your own cultural competencies and experiences that communities might need you, specifically you. And yeah, I hope that you guys have great opportunity to positively impact so many more people.
Thank you, Chris. Laurinda?
I would say don't get bogged down in the planning. Like, yes, planning is important, but don't get bogged down in that. Allow the organizations that you're working with, allow community to really help move and guide your steps. Sometimes it's okay to build and fly the plane at the same time. Last but not least, your evaluation is really just learn lessons to help you figure out how to pivot if you need to pivot and how to move forward successfully for the betterment of community.
I know I certainly have learned a lot of lessons from all of you today. Thank you so much for your wisdom, your expertise, your empathy, and your feedback. And to all of our attendees, thank you for taking an important hour out of your day. Clearly, if you attended this webinar, you too are immersed in this work, and I appreciate all that you do. If you are interested in learning more about what's going on at IAMHP, I encourage you to like and share our website, as well as our Facebook, Twitter, and LinkedIn. We're going to have more webinars similar to this up on our website, so check that out always if you want to learn more about what's going on in the Medicaid managed care health plans. We'll be talking about care coordination later this month as well, so I encourage you to check that out on our website. We will be sending a recording of today's presentation to all of our attendees, and I also want to note that we have a video library as well as a podcast series, and if you want to learn more about what's going on, I encourage you to check those out on our website as well. With that, stay safe, stay well, and we'll talk to you all soon. Have a good one. Bye.